Yes.
Let's see. Now, here's a question for you. Which is the best for older mothers, IVF or mini IVF? Oh, there's no question that with older eggs, mini IVF is the only way to go. But now we're finding that at any given age, the baby rate per egg is 4 to 5 times higher with mini IVF than with standard high dose stimulation. So we started out with older women and we gradually moved down over the last 20 years to even younger women. Mini IVF is always the best way to go. And we know the science behind it because, I've done many ovary transplants and a lot of research on in vitro gametogenesis. And we're totally scientific oriented in what we do. And your emotions might tell you, well, if it's an older woman with less eggs, give her a higher dose of gonadotropin. But that's exactly the opposite of what's correct. What's correct is a much lower dose at any age will give you the best quality eggs. So it doesn't matter older or younger, you really should go with the minimal stimulation. And it's not just low dose, it's a very clever approach. Uh, the LH from the pituitary gland is very important. And the only way you can get that is with Clomid because it's got a 1 hour half life. And so you can't buy it, you can't get LH. And also the prior sensitization with birth control pills to kill off the bad quality eggs, that really helps an awful lot in giving us a really, really good yield of eggs. But the main thing to realize is that the number of eggs you get is not dependent on the dose of hormone. It's only dependent on your intrinsic ovarian reserve. So increasing the dose of hormone doesn't increase the number of eggs, it just ruins the eggs you get. So my answer to your question is mini IVF is the best approach at any age. But of course, at some point, like Dawn reached, your eggs just aren't going to be able to do it anymore. And at that point, you can still have a happy baby. Now,
Yep.
I've said this many times, I'm going to say it again. DNA is not that crucial. You can match for your appearance and background, but what you care about mostly is personality, character, intelligence, emotional stability, and bonding with you as mother. And those 5 features in the baby are not in the DNA. I guarantee you that we've been doing this since 1986, and we understand how it works. These intangible qualities arise in the first 2 or 3 years of life from how you interact with the baby. So that's why Dawn's baby is going to be extremely intelligent and extremely confident
Yeah.
because there's going to be this great interaction that older women have with their babies.